fraud, and waste. And then the final part is, how are we going to pay for this, right? So, okay, it's a reasonable question, and I brought it up myself. First of all, the Congressional Budget Office, nonpartisan, came up with the numbers saying, and you know, let's talk about the Congressional Budget Office. It's interesting to me that when each party gets the numbers they look for, then they sit there and say, look at these numbers. And then if they don't see the numbers they wanted to see, then sometimes a few of them are scornful. The reality is that the Congressional Budget Office is nonpartisan, and they do a very, very good job. They did a good job with Medicare Part D. They're actually very, very conservative about this. This is going to be paid for, and it's actually going to help reduce the deficit. And we hope we'll control costs. So I'll wait.
When it started. What was the original CBO estimate?
I'll wait. When everybody's ready, then I will continue. Okay, so this is what's going to happen. Everybody? Okay, this is what's going to happen. The way that we're going to pay for this is, part of it's going to be paid for by controlling the waste, the fraud, the repeats, taking Medicare Advantage, which has been receiving about a 14% subsidy over traditional Medicare, and taking that away, because there's really no reason for privately delivered Medicare to do that. So that's the first part. The other part of it is, for those who are earning $200,000 as an individual, $250,000 as a couple, will pay more on their hospital tax. So we'll see that for the Medicare.
That's not fair.
So we'll be paying that. And I think I want to point out to you that everybody who voted for that health care bill already had health insurance. And almost everybody who voted for that health care bill voted to put the tax on themselves as well. That's where critical condition.
So brave.
So I think it's important to point out the members of Congress who voted for that had health insurance themselves and voted to tax themselves. Okay. The other part of it is a 3.8% tax on higher income to pay for that. So not income, but the higher earners, and it'll be on unearned income. In other words, not for their job, but for others. Now, 200,000, 250,000, most Americans don't fall anywhere near that. That really is about the top 2%. So most people will not feel that at all. And that's how it's
Everything you said sounds so nice and sounds, oh, that's going to work out great, but, you know, you said, oh, it's going to be free preventative care and free this and free that. Well, nothing's free. And it comes somewhere, we can't just pull it out of thin air. And I cannot wrap my head around these numbers. I think they're misleading. I think that there is no way that we are going to be able to afford this as a country. And I see us, you know, I see great economic stress coming because of this. And I don't think it was thought out well. I think it was rushed. And I think it was certainly taken a lot more time to consider everything. I'll leave it at that. Thank you.
I think you have a few more seconds if you want to add.
No.
Okay, well, first let me say thank you for your comment, and I understand what you're saying, but it wasn't rushed. Believe me, it wasn't rushed. For 100 years, several presidents, Republicans and Democrats, have called for health care, for a healthier America. Now, let's get back to the costs, because first of all, we know that if we're healthier, we're more productive. We're more productive, we're working. If we're working, then we are productive members and able to contribute. So, but as for the Congressional Budget Office numbers, all right, they tend to be conservative. They have been used many, many times by Republicans and Democrats.
Are they ever wrong?
Well, they were right on a whole bunch that I looked at.
I'm just asking if they're ever
We have
wrong.
a sheet on the CBO, how they got there. So the other part of this, and I did tell you how we were going to pay for it, right? So So there is one.
Call. Anyways, I have 2 minutes, and I appreciate it if you kept your answer to 2 minutes as well, because a lot of people want to ask questions.
Depends how complete an answer you want. It's a complicated issue.
Okay, I can't be trusted to hold the mic either, but anyway, I'm a healthcare professional, and most everybody I talk to is, as patients, healthcare professionals, don't agree with this bill. If you talk to anybody in this country, especially healthcare professionals, they will say we do need healthcare reform. No doubt about it. However, the bill that we got is absolutely the wrong medicine for what this country needs. First of all, you said we spend 2.5 times more. Well, you should have addressed the reasons why that is. The cost of doing business in this country is extraordinarily high. I wrote a letter to your office about that, and you really didn't answer my questions or my comments regarding that. Anyway, finally, every poll that I have seen says that the people of this country and this district overwhelmingly did not support this bill. And my comment is, you were elected to represent our district and the people in their will, but you voted for the bill. So could you please explain your vote for the bill?
Sure.
I'm just a mailman, so I don't really know a lot about the government and the way it runs, so maybe you can help me out. I thought that we, as a people, as your constituents, told you what we wanted. And you went to Washington, and hopefully those beliefs that we expressed to you became part of the fabric and laws that were passed as laws. Can you tell me why that we see the president convincing our representatives what to vote for, and then our representatives come here and tell us what we should have wanted all along? Now, a government by the people should start at the people, shouldn't it? The second thing I want to point out is that before you answer this question or make a comment about healthcare and your views on it, with all due respect, it's not really important because you work for us. Our opinion matters, and as Joe Proxy employer, your review's coming up very soon.
We spend over $300,000 a year to insure our employees. I don't fall within your guidelines of tax credits and this and that. What benefit do I have to continue to provide my employees with insurance instead of dropping them and dumping them on the government program?
How many employees do you have?
22.
You have 22 employees?
Yep.
Okay.
And they earn over $50,000 a year on average.
All right. So your question is, why wouldn't you dump them?
What benefit do I have as a company owner to provide this when I can dump them on the government program?
Could you dump them tomorrow?
Yeah.
That's the whole point. That you
But that just
could,
puts more people on the government roll.
but you haven't done that, and you're not going to do that because that's what you offer as part of the agreement that you have with your employees to bring them. Because if you didn't want to offer it, there's nothing saying that you have to offer it right now. So you don't strike me as somebody that would do that because you're offering it at this moment.
Thank you.
And that's the reality, that we know that people are going to continue to offer insurance as part of the benefit package. What we're going to do through this is to help, you know how high and how fast premiums have been going up. Right, that's right. So if we did nothing at all, the costs would absolutely bankrupt this country. They are spiraling. And I hear from small businesses and I hear from people all the time they can't afford the health care
We're already bankrupt in small
Right.
business.
So what we're doing is we're working to try to control the costs. And I think that we will see that. It'll be interesting to have the conversation with you once we start. But if you want a more detailed response about that, we have all the sheets that you need if you haven't received them about businesses and the impact that will have.
I'll send you a letter on that.
Okay. All right. Thank you.